Hi, my name is Alex with the Nursing Student Mentorship Program here at Formosan College. I'm going to be demonstrating today how to take a set of vitals on Jennifer here. Hi Jen, how's it going?
Good, how are you?
I'm good. I'm just going to be taking a quick set of vital signs on you, is that alright?
What are the vitals?
So it's going to be a blood pressure, a heart rate, a temperature, and I'm going to put a little thing on your finger that measures the amount of oxygen that is bound to the hemoglobin in your blood.
Okay.
And then I'm going to take another pulse, alright?
Okay.
Alright, so is it okay to use this arm?
Yeah.
Yeah? Okay.
Yeah.
I'm just going to put this on that arm, okay? So I'm going to line up that artery mark there. There we go. I'm just going to put this on the other hand, okay? Just going to clip on the finger there. Alright, I'm going to get that going. While you're doing this, it's a good time to check the temperature tympanically. Perfect. You appear to have a fever. While that's going, I can come over to the other side. I'm just going to measure her pulse. I'm just going to grab your wrist here, okay? So I'm measuring the pulse at the radial site because although this does pick up the pulse and the SpO2, it doesn't always tell us the rate and the rhythm of said pulse. So it's good to get a better idea by putting hands on your patient and actually feeling for that rate and rhythm. And while you do that, it's also beneficial. You can pop your hand right here at the patient's sternum, and when you can count for 30 seconds that radial pulse, and then for the other 30 seconds, what you can do is you can actually monitor the patient's respiratory rate by watching the rise and fall. It's important to do this while you're taking the pulse because if the patient is aware that you are taking their respiratory rate, it's going to skew the actual rate. Perfect. I'm going to go back around to this side of the bed here. Alright. Because this machine is linked to the bed, I can actually save the vitals here. However, if you are using a machine that is not linked to PowerChart or to the bed, you're going to have to make sure these are written down before you disconnect, because sometimes you can lose the values. Alright, now that I've completed a set of vitals on Jen, I'm going to review some of the key components of taking vital signs. One of the first things that you should remember is to take your blood pressure and or hook up your blood pressure machine to the opposite arm as your SpO2 monitor, as the blood pressure machine can skew the results of the SpO2 reading. Additionally, you should take your pulses bilaterally for 30 seconds in order to determine the rate and rhythm, as your SpO2 monitor will check the pulse rate, but it will not actually give you any data about the rhythm and quality of said pulse. While you are doing that pulse, it is a good idea to take your respiratory rate, as it can be skewed if the patient is aware that you are taking it. Additionally, you should be talking to your patient while you are doing these things. It's a great opportunity to get additional assessment data, as well as it's important to remember that your patient is a human and they are sitting in front of you. So staring at your blood pressure machine while it's going up is not actually connecting with that patient. So find something to talk about. You got this. If you need any more information, please refer to your third Canadian edition of the Jarvis Physical Assessment Textbook on pages 172 to 175.